Good morning, Las Vegas. This is Tina Drago and Jim Godwin with Healthy Nevada. Yes, we've changed our name because we've gotten bigger and better. Hi, Jim. How are you today?
I am doing great. How are you today, Tina?
Wonderful. So
Outstanding.
Everybody out there in the listening audience, Jim Godwin is with the Primary Care Association for the state of Nevada. Every state has one, and ours is, I think, the best. What do you think,
I
Jim?
agree. I concur wholeheartedly. I really do.
Now, most of you out there don't know about the Primary Care Association because, to be perfectly honest, for the first 30 years of its life, it didn't do much. But since Nancy Hook took over 4 or 5 years ago?
Yeah. We just had our 20th anniversary last year.
Oh, 20th. Okay. So I exaggerated.
You know what? That's okay. It keeps the fact checkers busy.
Exactly. So Nancy took over about 4 or 5 years ago, and really we only had 2 primary cares or 2 community health centers in the state, right?
Yes, we only had 2 federally qualified health centers, community health centers in the state, and now we are up to 6 federally qualified health centers and 1 federally qualified health center look-alike.
Well, don't make me second-class citizen.
Care clinic. I just like to make people blush on the radio.
You know,
they just achieved their status. They're run by some lady, Tina Drago.
It's Drago, like the fighter.
Congratulations.
Right? Yeah. So we finally made our look-alike status. Woohoo! Can I hear a cheer? So, and then we'll be going competitive for the competitive mark. But I personally think being a lookalike is much more difficult than being a grantee, even though grantees get the money. We had to do it without the money.
Oh.
Yeah. We had to meet and pass audits and have quality standards and do all of that the grantees didn't have to do for the first 2 years. You know, they got 2 years to pass it with money.
Yeah, break it in. Oof.
So,
well, you're the one to do it, Tina.
I'm just stubborn as a mule is really what it's all about. So talk to us about what the Primary Care Association does for the federally qualified healthcare centers and you know, the people out there, how it dribbles down to, you know, the average Joe person.
Okay. Well, we're the Nevada Primary Care Association is a federally funded nonprofit, and we basically provide assistance and support to the community health centers of Nevada and the lookalikes and just the health centers and any migrant, homeless, or public housing health centers.
And the tribal?
Yes,
and the
tribal as well. So we basically just provide assistance and support and help disseminate information for all the community health centers, and we work out with the National Association of Community Health Centers and the Bureau of Primary Health Care just to make sure everything's running smoothly and they're getting the optimum care or providing the optimum care that they can. That's about it. And also if we try to elevate the awareness of community health centers.
I think you're being very modest.
Oh, you think so?
Well, you know what? Okay, so for me, as a federally qualified healthcare center lookalike, I rely on you guys for quality assistance. You know, the government expects a lot out of its federally qualified healthcare centers. They want quality measures to be met, and they want patients and outreach and community development to be done, and they want a lot of resources to be provided to the people of the community that they're working with. So this is kind of daunting. It really is. No matter how well you think you're prepared to go into this as a business, when you finally get there, and I said this when we became a lookalike, it was like peeking behind the wizard's curtain. Then they tell you really what's expected of you. You know, and they kind of gloss it over. They make it nice. It's like used car salesmen. You know, sure, you want to be a federally qualified healthcare center. You want to do all this, and we'll lure you with incentive payments and tuition reimbursement for your providers. And they have all these little carrots they lure you with. But when you get there, it's pretty complex.
How? They get right in your face with the daunting and the dizzying task.
They do.
Of running a health center.
So what the Primary Care Association does is they're our muscle. They're our backup. They're our communication. And they're our training. You know, so we have peer training groups, and then we have training groups on basic things, how to bill, the changes that are coming out, what kind of quality measures there should be. You know, all those little things that make a business run efficiently and allow the providers to do the actual caretaking while the administrative staff runs around them in circles and makes sure everything looks beautiful. And you guys are that support network.
Thank you. That sums it up quite eloquently.
And also you're a lobbying arm too for us. So when all of us get together and we're not happy about legislative change or something like that, you guys actually go to bat for us. You're that focal point.
That is correct. Every 2 years when the Nevada State Legislature is in a session up here in Carson City, we have our Community Health Provider Day.
We get to go up there and meet all the powers that be.
Yes, with all the members of Congress. And actually this last year, we were the driving force behind getting patient-centered medical home language into law, which is this great thing. A lot of, I think over 80% of the community health centers in America are patient-centered medical home qualified.
And what makes that such a big deal?
Oh, well, I was shocked when I heard it because it sounds like such an obvious thing to do with your healthcare practice. And basically, it kind of makes your primary care provider your all-inclusive caretaker provider.
The hub of health.
As far as behavioral health, physical health, and helps address the social determinants of health, where you live, your access to healthy food, and it kind of combines everything into one package. So, for instance, if you're a good example is if you're dealing with somebody who's an alcoholic, you treat them for their alcoholism and health problems, and also the root problems behind why they became an alcoholic. It kind of
So you have your drug addiction programs available to them. You have your behavioral programs available to them. And you also have your primary care, because most of the time, if they're not going to take care of themselves because they're doing, a controlled substance or something, then they also probably have diabetes or hypertension or weight issues or some other health issue.
Exactly. Just the integration of people's well-being.
So are we treating...
So it's all right there, and they all influence each other.
Are we treating the person as a whole and not just parts?
Exactly. I apologize for stumbling over my words. I'm a little nervous.
Oh, chill out.
I've done a lot of professional theater. I've done pilots. I've done movies that are horrible and gone straight to DVD. And I got to tell you, the most nervous I've ever been is on the radio with Tina Drago.
Oh, my gosh.
I know.
We already had the fun session about what you're wearing, so I don't know. You should be really relaxed. Here, let me tell you this. Jeff, you can edit out any portion, okay? So Jeff is our editor. So he's going to edit this whole section out where I say, when he says he's nervous, Jeff, take this all out. And we'll start with how wonderful the PCA is and what they offer. Done.
Yeah, and then just try and add in my charisma, boost it up a little, like George Clooney's.
Oh, he can do that too.
I think they have controls for that in the studio.
So the best part is that we have. I'm recording us now, and then we go back to edit. So you'll be fine.
Oh, outstanding.
You'll be fine. They take out all the hums and the oh by the ways and that stuff, and a lot of breathing. They take out a lot of breathing.
Oh, okay.
So when there's awkward silence, they can take that out too.
Snip it out.
Yes. So we have. So what I find of value with the PCA is the touchstone. I just had a session yesterday. We talked about quality measures, because not only are we doing meaningful use quality measures, but we're also doing UDS quality measures and patient-centered medical home quality measures. And I'm looking at each section of those people out there in radio land. Each area speaks to a different part of the government. So for me, I'd like to say I want one standard of quality that meets or exceeds all those areas, so that no matter who you are in the government, when you look in on the organization, I've met your quality standards. And so we had a big powwow yesterday about that. We had Health Insight. We had Kimberly from the Primary Care Association down. We even had Nancy Bowen on the phone talking to us about billings and how we do that. So those little things all I couldn't do without the assistance around us.
Yeah. Well, and you say they're little things. I think they're the part that most people see when they go to get their health care is the tip of the iceberg.
Oh, absolutely.
And then a lot of what we're discussing is the huge, massive amount underneath the water that it takes to provide the care.
So I'll give you a perfect example. When you go to a doctor and that doctor refers you, let's say they refer you to pain management. that referral that you get and that phone call that's made is really the very, very basic tip of the iceberg. You're right. Because what goes into it is our collaborative relationships in the community, finding these resources, making sure that they accept patients. And then once we send the referral, that's not the end of our story. They have to send us back information about you. So they need to let us know, yes, this person has this diagnosis or this issue, and we're going to be treating them that way. And then we incorporate that back into our system, and that actually closes one referral loop. And we do something like, 125 referrals a day. So there's a lot of communication and a lot of trying to figure out how we close those loops so that we're actually meeting our quality standards and that we're doing everything that's expected of us. So it goes on far beyond when the patient leaves the building. And then you have to figure out how to capture that information, because even though we might do it all, then you have to capture it in the appropriate way that the government deems is appropriate so that they can give you credit for it.
Exactly. And then that's also important to record all that data so you can show the benefits of the health centers and the good they're doing in their respective communities.
Yes.
And the betterment of the health of the Nevadans.
And I think that's the hardest thing. I think most community health centers and federally qualified health centers really do a phenomenal job. It's the administrative capturing it so that they can demonstrate that on paper that is daunting, really difficult.
Exactly. It makes my head swim. I just report the numbers. I don't actually collect them. So.
And each computer system has a different way of collecting them too.
Oh, yeah.
Yeah, surprise. So those are the type of things that go on behind the scenes. Now, I don't want anybody to say, oh, I don't want you to work so hard. No, that's our job. That's what we're supposed to do. So when our patients come in and we get it, I didn't get that call back, or that referral doctor didn't do this or didn't do that. Really it's our responsibility to help them help themselves. So, we'll say, okay, did you call this number? Did you set up the appointment? Let us follow up while you're here and make sure that they can accept you and try to put those pieces together without actually taking on the role of the patient.
Exactly. Well, that's good. That's good for people that don't work in the healthcare industry, just to keep in mind. I mean, going to the doctor can be frustrating and whatnot. It's just good to kind of keep that in mind and realize it's a lot of cogs and wheels behind there turning.
And please, 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 if you are going to go to the doctor's office or you're getting a referral, make those appointments. Please show up. Please show up. That is like so much work for nothing if you don't show up. And it really makes it more difficult. That's all I can say. You have that in your control, patient. Please, just show up to the appointment.
Yeah. And if you make the appointment, keep the appointment.
Yeah, or at least reschedule if there's something that comes up. We know life gets in the way, but reschedule. So there's that, and then there's the basic things like my big push this year. And I've been kind of whining about it because I'm the newest one on the block, is getting, when you become a federally qualified healthcare center, part of your business model has to start all over again. And so the insurance companies have to look at you differently now. They actually change your provider type and they reclassify you. And if you have been going along as a provider type 20, which is your average doctor, out there, medical office, and then you switch to an FQHC, you switch to a provider type 17. Well, it only took Medicare 2 weeks to switch us to a provider type 17. But I hear Nevada Medicaid takes sometimes quite some time. So we're going to be pushing that to see if we can streamline that process. Yeah, it is, because you don't get paid during that time.
Yeah.
No money, no honey. So I want to keep the doors open. I'm like, yay, I became a federally qualified healthcare center, and I can't help you. So, so those are the type of processes. So quality is a big deal. Payment schedule is a big deal. Making sure our providers. One of the great things is. And this is like really minutia detail, but doctors can get tuition reimbursement working for a federally qualified healthcare center. So any of you young doctors, isn't that great?
Yeah, it is one of the many great features of community health centers. is that you can pay off all of your student loans through working in a community health center. And I have to say, a lot of my life I did not know what a community health center was. And now that I do, I wish I had known a lot earlier. It would have made a lot of my crazy 20s a lot easier. But,
would you have become a doctor?
Yeah. No, I just wouldn't have just would have had a little better time. Because community health centers, they'll take care of you whether you have insurance.
Yes.
Or if you don't have insurance, and they work with Medicaid and Medicare, and they'll work on a sliding fee scale.
Yes.
Dependent on your income, so it makes it a lot more affordable to go see the doctor and take care of your body. Because a lot of the times before I knew about community health centers, if something was wrong, and I didn't have insurance back then before the Affordable Care Act, I would not go to the doctor for fear of the bill.
Oh my gosh, you're a typical guy, aren't you?
Pretty much I am a typical guy. I did not watch the Super Bowl, though. So
oh my gosh, you didn't?
I'm not. No, I did not.
Hard hitting, great turnovers. Oh my gosh.
I know. I watched some of the highlights. I got to say, I'm a bit more of a baseball fan.
Can I tell you, Lady Gaga singing the national anthem?
Oh, I did see that.
OMG.
I can't watch the. I have a 1-year-old baby, and he's a handful, so he gets in the way of a lot of my sports viewing.
Really? You got to dress him up and get him involved. Woohoo.
I know. He's very overdramatic. He has big feelings, so he feels everything, and that's just too much drama, especially with it being Peyton Manning trying to win to cement his legacy.
And he
my
did.
Baby boy was just said, "That's too much, Jim. That's too much. You have the radio call this week. You just take it easy."
Is that what he told you?
Throw stuff in the garbage. That's what he said. He's very precocious.
Oh, he's probably teething right now too, which makes everything more amplified.
Yeah, he has the molars coming in.
Yeah,
good times.
Good times had by all. So all in all, when I think about it, now the doctors fresh out of school, who doesn't want to come to Las Vegas and set up their career? Come on,
exactly.
Young
Beautiful
doctors.
Las Vegas.
Beautiful, sunny, 74 degrees today and sunshine.
Great restaurants, great history, great shows.
I know, and I'm here. Jim's up in Carson City.
Exactly.
So he has the Carson City extension here.
A lot of the times I don't even call Las Vegas by its proper name. I call it Drago's Town.
Oh my gosh, thank you. Because it really kind of is.
It's the truth.
I have to tell you, my son started working, and he's working for a medical equipment company, and he's all of 22, and he's out there, and he comes home last week. It's his first week on the job, and he says, "You know, Mom, I didn't realize how many people really knew you." He goes, "You're kind of a big deal." And I was laughing. And I said, "I love the fact that you think that, because you're my child and you should have thought that all along." But but no.
That must have felt good, though.
It was like an epiphany for him, like, oh, she's not just my mom rooting for me on the soccer field, you know.
And I think I, along with your son and a lot of population of Las Vegas, applaud you and your efforts. Everything you do with your first-person care clinic.
You know what? I want to make sure everybody knows that there is good, affordable, high quality, and I emphasize the high quality care.
Yes.
And
exactly.
We have people, okay, now if you're out there and you have an insurance that you got off the exchange with a $6,000 deductible for the year, come to a federally qualified healthcare center. We'll put you on a sliding scale. We know that you're not going to spend $6,000 in a year. If you're an average healthy person, you know, we'll work with you. But you have to have the insurance, because that's the law.
Yeah, it's a great way to take care of yourself and make sure you're healthy for your friends and family, and to get the most out of life. It's really a great thing to have.
I was telling Kimberly yesterday that I'm going to start getting autographed pictures of some of our clients, because we have a lot of fighters, a lot of UFC fighters and MMA fighters, and we also have I have half the crew of Thunder from Down Under as our patients. And I just
that's why Tina goes to work every day.
Girls got to have motivation. So, but the reason we have that, and it's funny you say that, but we accept international insurance. We're one of the few medical offices in the city that accepts international insurance, and all the guys from from Down Under are Aussies. They're from Australia.
Yeah.
So that's their
Down
insurance. Under. And we have a lot of celebrities on the Strip that are not from this area. So they have travelers insurances and things like that, and they end up at our place. So
that is so cool.
Yeah, we have a great mix of people. We have people from the $1 million lofts downtown, and we have people that are 3 generations to a one family, 3 generations in one household, and then we have their couch surfers. So and our young kids and our entrepreneurs. Our biggest population that's uninsured are our business owners, our small business owners, our independent agents. That's a large uninsured population. So.
Wow, all that is so interesting. I did not know about the international insurance.
Yeah, we have a pretty colorful mix of people. Any given day, you'd be surprised.
There you go. Every time I talk to you, I learn something new.
Well, you just have to come down more often.
I know.
Now,
I do enjoy.
I think you have an office.
Las Vegas.
I think you're going to have an office down here. So no excuses.
That is correct. I know.
It's about time. They've been hiding up in Carson City, this office, and then they have to travel the state. And I don't know if most of you know that Nevada's kind of bipolar. The North and the South don't necessarily get along that well. There's different personalities. And
that is true. Most of it I think silly, but...
Well, and you have to bridge it. Your job is to bridge the gap. Your mom and dad.
Exactly.
So as we wrap up this show, what else would you like to say on your maiden voyage?
Thank you if you're still listening, and thank you, Tina, for this opportunity. And I hope this helps send an echo of community health centers out into the community so more people know about it and take active participation in their healthcare.
So if you're out there listening to Jim's voice and you're like, what a beautiful voice on there, he's going to be with us. He's going to be with us as part of the team now. And Jim's going to be bringing in different people from now all over the state. The last year we focused just on Las Vegas, and we've brought in a lot of great opportunities here in Las Vegas. But I think everybody in the state needs to know what's available statewide, because there's services out there, whether they come from the north or the south, that anybody can, utilize. So, Jim, your job is, right?
Yeah,
you have no choice.
Is my job.
You have no choice but to accept this job of feeling comfortable on the air and bringing in people to talk about really fun, unique things that our listeners out in the community need to know, want to hear.
Yes.
Right?
I'm very excited, and I have some great guests lined up.
Oh, now he's teasing us.
Should be very, yeah, that's right. It's called a teaser in the industry, folks.
Well, I do appreciate all the help I can get. As our clinic grows, I need more and more assistance, and I think Jim is the ideal person to actually take this bull by the horns and give us great information out there for the state.
Oh, well, thank you. You are so kind.
Now
kind.
Understand that when I say healthy Nevada, it can be anything that makes you healthy. I was telling my sister, who's into couture fashion, that sometimes that new outfit just makes you feel so good that you push depression away and get out of the bed and go see the world.
That is a fact, being comfortable in your own clothes.
Exactly. So
being comfortable in your own skin.
Fashion and health and nutrition and resources that are available. I love the resources because every day there's more and new resources out there for our community. And I think that's important.
Yeah, there's a lot of, there's just a lot of information out there in general, but it's nice to have places like community health centers of the PCA to help filter through and funnel some of that information so you're getting good quality information about your health.
So you can go to our Facebook page, First Person Care Clinics, or you can go to our YouTube page and you can listen to this show, or you can listen to it when it airs Sunday mornings at 7 a.m. on KDAWN. But that's KDAWN 720 a.m. But in the meantime, I'm going to sign us off. Jim, any final words?
I hope everybody has an amazing day.
Woohoo. Okay, this is Tina Drago and Jim Godwin with Healthy Nevada, coming to you from the Beasley Broadcast Studio A. Have a wonderful day, everybody.